Why are people who have a substance use disorder more susceptible to COVID-19? Well, there's obviously a physical impact. When you use drugs and alcohol, there's going to be a physical impact in that. And a lot of that has to do with the heart and the lung. Opiates, as I said earlier, opiates, people are with an opioid use disorder are more susceptible because, use of opiates works on that respiratory system and slows that respirations down. And that's what leads to overdoses and that kind of thing. So it impairs that lung function, impairs heart function. Other drugs and alcohol impair heart function as well. And so those are the people, the heart and the lung, if they're not operating correctly, that's when people had difficulty with COVID-19. They were being put on ventilators and that kind of thing. Also, drug and alcohol use promotes the development of things like diabetes and hypertension. Those were risk factors. Those people who had, they knew early on that those, folks with those kind of, health issues were at a higher risk to get COVID than other people. And use of substances promotes that development of those disorders. So the substances really have an impact on your physical health, which really has an impact on your ability to not, to get COVID, but also have the serious side effects of COVID. There's also barriers to healthcare that people who struggle with addiction or use drugs and alcohol have, and we're going to talk about that in a minute. And there's also just with the COVID-19 precautions, social distancing, being in environments with a lot of different people. It's just, that this population, these folks, have just more difficulty with those kind of things. And we all have difficulty with social distancing by all means, at our Oakdale Recovery Center, our residential environment. We're continuously having to tell folks to spread apart, wear your masks and those kind of thing. And part of it makes sense. They'd much rather, they'd much rather sit at a table with 4 people playing cards and 2 people, not doing much interacting. So, and especially in that early recovery time, you're just looking for connection. You're looking for someone to share with or get support with. And social distancing and everything else has really, impacted that, especially in the beginning of COVID and everything else. So I talked about barriers to healthcare. So some of those barriers, in regards to substance use disorders, part of it is stigma. There's obviously, and we've talked about it in these meetings before, there's obviously a stigma to those folks who struggle with addiction. They're reluctant to seek medical care. They don't, there's a trust factor there. There's a fear factor where if my doctor finds out that I'm using drugs and alcohol, are they gonna stop treating me? Are they gonna take away the medication that I'm getting for this other disease? Are they gonna take away that because they don't trust, they don't like, the interaction of those drugs and alcohol with that medication? There's a lot of shame that these folks feel as well. And having to admit that, yes, I am addicted to drugs and alcohol. So that stigma really stops them from reaching out to other people. And then the medical community, there's still a stigma out there as well. And we've done a wonderful job the last 5-10 years, especially of really educating the medical community on that addiction is a disease, that these folks are sick, that it's no different than other diseases that they treat. But hasn't gotten to everybody. And so these folks, are looked at as, they're lazy, they don't care, they're selfish, they don't understand that lack of control that goes along with addiction, along with use of substances, or anything like that. So, there's a stigma that stops them from reaching out to healthcare, reaching out, for resources. Vaccinations, vaccinations are everywhere now. Well, anybody can get. I just read today that now it's 12 years and up. It used to be 16 years and up. Now it's down to 12 years and up. And we have so many sites and so many, ways to get that. But those resources, resources are not always there for folks who are struggling with addiction. They're not, and it's just, they might not have the knowledge. I get a lot of information just from Hegira, and working at Hegira, I get access to a lot of information. I was able to get vaccinated back in January and February because I was an employee of Hegira. Those are advantages that I have. Folks that, might be unemployed, might be, again, don't have a lot of resources, lack transportation, the ability to drive, what have you, they're not going to have that knowledge, not going to have those resources. And then also, most of these have two injections to be vaccinated. So, we, for example, at Oakdale, we're able to take people to get vaccinated, and we're actually going to have a lab coming in soon that'll come in on a weekly basis and vaccinate people, which is wonderful. But they're not with us for, 2 months or whatever. If they've been with us for a couple of weeks, they decide, okay, I'll get vaccinated. Then they leave 2 weeks later. Somehow they got to get to that second appointment 2 weeks after that, And while we'll try to, set them up with aftercare options or what have you, it's more difficult for them to be able to get back to that site to get that second vaccination. So again, there's just more barriers. And then there's less treatment opportunities. Unfortunately, that's, COVID has had a major impact on the behavioral health, treatment setting. There's decrease in withdrawal management and residential beds. We have 45 beds at Oakdale. Because of COVID, we decreased that down to 35 to promote social distancing. We're not the only one. Every residential provider had to do that, not only in Wayne County, but throughout the state. So there's just less beds for these people. You've got more people using substances, using more intensely or what have you, and you have less beds for those people to use. So there's longer waiting lists, longer waiting times. Virtual versus face-to-face services. Everything before COVID was face-to-face. We didn't do much virtual, many things virtually at all. Virtual really had to do with folks in the more rural communities. But when COVID happened, we all had to do a 180 and we all had to get virtual services going. And there's been a benefit to that, but it's also been a barrier. It's been a wonderful opportunity for people it's opened more doors for people, that you just have to have a smartphone or you have to have, a computer. And when we first started with virtual at Hegira, for example, we just did phone services. We called you on the phone. If you couldn't get online, okay, we'll call you on the phone. We'll do a session over the phone. So it's given a lot more opportunities for people, but, just like this meeting, this is a wonderful, venue for us to do this, so to speak. We have the opportunity to do these meetings via Zoom, but as we said earlier, it'd be much nicer, and we would certainly enjoy it more to be together and to be face to face and be in a room together, and there's more connection that way. And same thing with treatment services or what have you. If you're working with a therapist, you're getting benefit out of that virtual treatment, but you're also, it's not, you might not get as much out of that session without being face to face with that person. So sober housing has decreased. There's some shutdowns. A lot of programs have shut down. There's a loss of revenue because of COVID, so there's less opportunities that way. And then also in residential environments or housing environments or anything, when you have one patient test positive for COVID, then everything has to shut down. You're missing shutdown. And so again, less opportunity for people to get services. We have less beds. Now all of a sudden, let's say Oakdale, for example, is shut down to admissions for a couple of weeks while we work through this whole COVID process. That's 35 less beds that are available to people in Wayne County. So it's just, there's been a lot of barriers that have been, as a result of COVID. However, we always like to look at the positive too. We don't always want to look at the negative, and not everything is horrible. So, excuse me. So there have been some positive changes to the substance use disorder, treatment community and recovery community as a result of COVID-19. So again, we talked about virtual formats, and it has eliminated some barriers to accessing treatment and services. There, AA meetings and smart recovery and all those, they have a lot more virtual formats now for people. So there's a lot more. Everybody's becoming more comfortable with that aspect as well. So that's been an advantage in a lot of ways. Medication-assisted treatment. Methadone and buprenorphine and naltrexone, medications to help people with their substance use disorder. There have been a lot of changes in that field as well. They can have telemedicine versus face-to-face. You used to have initially you had to have a face-to-face appointment. Now they loosened that up a little bit, so you could do some virtually. There's longer take-home times for methadone. When you first start with methadone treatment, you have to go into that methadone clinic every morning. Then eventually you'd be able to do take homes maybe a week at a time. They extended those to where it could be up to possibly a month, depending on each individual situation. So there's been some expansion of the rules and regulations regarding medication-assisted treatment to help people access those services. There's been an increase in mobile programs with the philosophy of, you can't come to us, so we're going to come to you. We at Hegira have increased our mobile programs, but there's been other ones that'll go into the community and to the person and continue to eliminate any kind of barriers. You can't get to us, we'll come to you and we'll provide those services. You're in a setting we can't get into because we can't go into the building, but maybe we'll be outside and people can come outside and get those individual services. So there's been an increase in mobile programs. There's also been an increase in funding, and don't get me wrong, we have not financially, we have not done well in the treatment community because of COVID, and certainly have lost a lot of revenue. But there has been focus, obviously, in the state level, the county level, of increasing funding to assist getting through this process, and whether that be accessing and obtaining PPE and other assistance. There has been some increased funding and increased in different programs created because of COVID. So, there's been some positive aspects to it, but we in the treatment community understand that this is a long road that we still have to go. And even once we get to normal, whatever normal looks like, and get through this pandemic, there's still going to be long-lasting after effects for people. Those emotional and mental and behavioral consequences and impacts that they've had because of COVID, those are going to continue on, and those are the things that we'll be dealing with for a long time. And we're certainly ready and prepared to deal with that, and we'll continue to do so. But I appreciate everybody's time and attention, and now I will turn it over to Melissa.